Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer, a dental hygienist from Bulgaria, Buffalo, New York, Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers, 8 Lumineers, 10 Lumineers, 6 Lumineers, 10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient. And now we're not treating teeth anymore. We're treating smiles. Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Welcome everyone to the Lumineer webcast on the placement of, I guess we're going to do 8 or 10 Lumineers on this young lady, and we're going to do it. Did I grind in any of your teeth yet?
No.
Okay.
I wouldn't be here.
And you what?
I wouldn't be here if you would.
Oh, if I'm going to grind. Now I am going to have to grind a little bit on this lower tooth. That's okay?
Yeah, that's
all
okay.
right. Yeah, I'll show that to you. So she's here because there's no grinding. She doesn't want to go through orthodontia. We already present that as an option. What I'm going to tell you and show you today is what I've been doing for over 20 years. I've been teaching this. And finally, when people find out they can have their smiles, corrected without any shots or drilling, it's amazing how many people want to have something done to their teeth. So the first thing we're going to do is we're going to be prepared. Now, you have to have a knowledgeable assistant. And our knowledgeable assistant today is Lisa. And Lisa's been with me since she was 17. So let's talk about the training, and the timing on that is very essential. So get you and your staff together and go through these DVDs 2 or 3 times on different occasions. It's like watching a movie. And so once you've seen it 2 or 3 times, you start seeing things on the 3rd time that you didn't see on the 1st and 2nd time. So you want to do this so that when you're all ready to go, your staff member can have the tray set up and be all set. So at any rate, let's take a look at what Lisa's done before we got started here. She's polished the patient's teeth, and she's used the porcelain polishing paste because that has an enzyme in there to help dissolve plaque. And that means you'll get a better attachment between the Ultrabond and the tooth if you've got it's like getting the grease off the tooth when you get rid of the plaque, to put it simply. She's also treated the surface of these porcelain veneers, the Lumineers, and I want you to think about what a Lumineer is. It's not a restorative. The restorative is the material between the Lumineer and the tooth. The Lumineer is the matrix. The Lumineer we leave on that surface to give it stain resistance, wear resistance, aesthetics, and we just take off the extra restorative that comes off around the edges. Some of the things that's going to make this simple, and it's critical that you get these things in, is magnification. I am wearing 4-power magnification. It gives me what I call supernatural vision. I'll be this far from the patient, visually this close. No human being, no matter how young they are, can see this close to an object and focus on it. So that's really what magnification does for us. The next thing that helps a lot is the sapphire light. The sapphire light's important because it cures through that porcelain. And if you have a halogen light and you're curing through thick porcelain or thick composite, not all of it converts from monomer to polymer. So you get a weaker bond. It's that simple. Just that simple. Another very important part of the equation is taking the impression. We highly recommend you use Lumineers impression material. It's a double wash. Get the perfect impression here, and let it stay in the patient's mouth an extra 30 seconds or a minute to be safe. Because sometimes when it fits the model and it doesn't fit the tooth, what does that mean? You got some distortion. So if you have the patient wait an extra hour, pour the models in your own laboratory, and you check it to see that you like those marginal ridges or those gingival margins. Because remember, we're not retracting any tissue. So check the model before you send it in, and that way you'll be sure it's okay. So here's our patient before. Very attractive young lady, and she doesn't like the spaces in there. And there's an occlusal view of this. And we're going to take and blend with the Serenade porcelain all over those teeth and fuse the porcelain to the enamel. Lisa has treated the porcelain with 2 solutions besides cleaning the teeth. She has put porcelain conditioner, which is an organic acid, but if you don't put it on, it doesn't activate your silane. And that silane that's in the Serenade Prime is inactive. It's got a very long shelf life. So you just activate it with an organic acid, and that's the 2 solutions that are on the porcelain. And we're going to put on some Paint On Dental Dam. And we're going to put it on the lingual side, and I'm going to put it every place that I don't want the Ultra Bond to stick to. And it really does simplify the finishing process. And she has a little diastema there, so I have to be careful that I don't have this run through that interproximal embrasure and prevent. Close your eyes. The best way to protect your eyes is to close them. Close. And I place it, close my eyes, and it goes for 3 seconds. Close your eyes. And I'm using the blue Paint On Dental Dam, the same one that we use for sapphire chairside bleaching. Close your eyes. So I always place the light, get a good finger rest, and sit there, and then I push the button. Close your eyes. Okay. Now I'll give everybody a little peek at what I just did. Open real wide. And then you can see the Paint On Dental Dam, wherever that is, the Ultra Bond won't bond to that surface. Now we're going to put the first solution on treating enamel, Etch and Seal. Etch and Seal is 30% medium viscosity phosphoric acid. It also contains aluminum oxalate. So if you're using it in your regular operative procedures, it will seal the dentinal tubules and help prevent sensitivity. And then I like to take the brush, that's why I use a medium viscosity, and I just push this all around where I want to etch the surface. Remember, we've been etching teeth since 1955. Bonacore and Gwinnett published an article in the Journal of the American Dental Association describing the technique of using 50% phosphoric acid on enamel for 2 minutes. And they were severely castigated by the powers in those days, severely criticizing them for putting acid on the tooth and dissolving those enamel structures. But they didn't mind using a high-speed diamond and removing 500 microns or 1,000 microns of tooth structure. And a fellow by the name of Bowen developed the basis for tenure. And he approached me one day at a ADA meeting in Atlanta, and he said, "Bob, I've got this fantastic dentin bonding system, which we now call Tenure AB, and nothing has been introduced that exceeds its capabilities or its versatility. You don't need a light to cure it, so it's light independent. And there isn't a composite resin that won't bond with it. And I like Tenure AB because when you put the 2 bottles together in one solution, it's just one application, as you can see. 10-20 minutes is pretty good working time. That was the question, what was the working time with Tenure AB? All right, now what we're going to do, and we're going to try 2 shades on for this young lady. Which one? Left central. Okay. Now the left central has air between the etched surface and the enamel. This is not the shade that you're going to get, and I'll tell you why here in just a minute. This is the shade you're going to get. We're using the Ultrabond Tri-End paste. Now the Ultrabond Tri-End paste is the same formula as Ultrabond, except it doesn't have any activators in it to convert it from a monomer to a polymer. And as you can see, the one on the left is a little whiter. Here's why. When light goes through a medium, light will continue as long as it doesn't exceed the critical angle in the index of refraction. As soon as it exceeds the critical angle, so when it goes from the resin or from the porcelain to air and then to tooth, it never gets to the tooth. What you get back is a reflection of the etched surface. I have to have a good assistant to remind me what I have to do next. I had to take it off the tooth. Otherwise, she couldn't put the next shade on. Everybody thinks the porcelains are restorative. So what do you do with those open margins? We never get open margins. Why? Because the Ultrabond is the margin. Okay, now we're going to give the patient the choice. I'll hold the mirror over here. You just feel very still. Okay. Which one do you like? They're pretty close, aren't they? The one on the right? Okay. Now, the patient got to participate in the shade and in the selection, and they're satisfied. All right. Now we're going to get rid of that non-setting Tri-End paste. And we're not going to remove it all from the tooth. We're going to remove most of it with this solution I'm putting on now called Tenure S. Now Tenure S you never want to put on before you do the Tri-End, because Tenure S will cause your Tri-End paste to set. Lisa's taking it out of the inside of the veneer the same way that I'm removing it from the tooth. Now the Tenure S does two things. It removes the Ultrabond, and I put it on the surface of all the treated surfaces, and I blow the excess off. Why did I put Tenure S on that surface? Because once you've prepared the surface, a race begins between resin and contamination, and whatever gets there first wins. Now we got there first with resin, so if you get a little contamination on there, you can blow it away. Left central. Lisa always calls out the name of the tooth. Right central. Okay. So we just start putting these on. Right lateral. Okay. Okay. Left lateral. Now what we're going to do here is get these placed. Left first bicuspid. Okay. And I can't tell you how easy this is to do with 4 power. I mean, I feel like I'm just right next to the tooth. So now what we're going to do is wipe off most of the excess. Okay. And I'm going to take the 2mm tip for 1 second and gently place it on the tooth. Close your eyes. And I go to the next tooth for 1 second. And then as I seat it, I see excess come out, but I don't put a lot of force on it. Close your eyes. And close your eyes. Close your eyes. And we'll take some more of this excess off here. See, by using that 2mm tip for 1 second, I didn't get the margins. I'm not going to do this to the cuspid, just in case I inadvertently polymerize some of the excess at the margin. It'll prevent seeding of the next veneer. Close your eyes. Okay. Right first bicuspid. Close your eyes. Don't move. And close your eyes. And don't move. Okay. Now, if we were flying an airplane, we're airborne, but we're not wheels up yet. Close your eyes. We'll do 5 seconds on each tooth. Close your eyes. Close your eyes. Close your eyes. So now we're getting our wheels up. 5 seconds in each tooth. Close your eyes. Close your eyes. Close your eyes. We're not using a lot of pressure. We're just gently placing it on the tooth. Close your eyes. Close your eyes. And close your eyes. Okay. Now we're going to go in and just trim away the excess. And we're going to take off that paint-on dental dam to begin with. This is the slickest trick for cleanup. There we go. And we'll let everybody take a look at that. Now look how nice that gingival tissue looks in there. Can you see that? And I just took off that paint-on dental dam. And now we'll begin the finishing. So now I'm taking a football-shaped diamond, American football, and I'm going to go on the lingual side and blend the 3 materials, Serenade Porcelain, Ultrabond, and her tooth structure, because they're all one homogeneous mass. Now you're probably saying, well, you didn't polymerize it on the lingual side. Well, I didn't need to. Now the reason I like to do the 8 veneers instead of 6 is when I tried them in, I only tried 6 in. And her immediate reaction was, gee, they seem kind of bulky, because when you don't have something making that turn, that buccal vestibule looks as though they don't have any teeth, and it makes the teeth that they do have look very bulky. Oh yeah, I have all this mess in here, and that's what I'm doing right now, is just blending the Ultrabond and the tooth together. Because when it comes time to open the contacts, I want to have as little Ultrabond in between the teeth as possible. So instead of spending time doing preparation on teeth ahead of time, I'm spending time on finishing. You see how it looks down the lingual, how we got all that excess off? That didn't take long. It was about 5 minutes. Okay, now I've taken a 12-fluted burr, and I'm going to go all the way around the margins of the teeth, and I'm going to remove the Ultrabond. Now, I use a 12-fluted burr because I never want to use it on teeth. I'm using it on porcelain, and it won't remove the porcelain, it'll just remove the Ultrabond. So now when I come back, with my finishing diamond, I know that anything that looks like tooth structure is not Ultrabond because I will have removed it. And this is a real important step. And this is where she had that rotated tooth. Remember how that diastema was in here? See, it's gone. What I'm using on scraping off the Ultrabond right now is a Shure 349 instrument. Now, all these instruments that I'm using for finishing are in one box called a Clinician's Finishing Kit. Everything I use is in there, so it's in one place. This is a very important instrument. It's an orthodontic band seating instrument, and it'll never scratch the glazed porcelain. And that's what I'm doing right now. You never want to use a hygienist scaling instrument because it'll scratch the porcelain like crazy. Now you notice how little bleeding there's been in here. Notice that? You get more bleeding out of a superficial scaling than you do out of one of these. Okay, little gauze here. And we'll wipe off the Ultrabond off the gums. See that Ultrabond just come off there? It was on the gingiva. See how that comes off? Okay, now let's take a look at what we've done here. Now remember, she had a crossbite with this maxillary left lateral, okay, and this lower cuspid. So what I'm going to do is reduce the lower left cuspid. Now gently close on your teeth. Just grind around a little bit. Open. Okay, there you go. See that little tip there? That little, right in here. See this point right here? Let's see if I can get that out. Okay, I've got to get that tip of that cuspid out of there. So I'm going to start shaving it down and bring it in lingually because it was in crossbite. I'm not using any anesthetic, so if I get to sensitive tooth structure, she and I will know it right away. So look at the mark here on the mesial of the cuspid. See that? Yeah, okay. So we take that out. Grind your teeth around. Open. Okay, now take a look at the cuspid. See that? Okay. See the distal of that lateral? Those are the things you want to look out for. I'm going to take a little off this cuspid here, the lower cuspid, taking off the labial mesial incline. Grind around on your back teeth. Open. And we're going to spend a little time on occlusion here. Then I'll go in and open those margins and open those contacts. Okay, and we've got to get all that out of there. So we use a football-shaped diamond now. Okay, open. Now I want you to close your teeth all the way. Grind them around. Now we take a look at all these marks here. And that first bicuspid on the right, we're going to take a little out of that. And we'll come back and start opening some of this for the contacts. And there'll be a little Ultrabond and things like that, but you want to make sure that when the patient moves her occlusion from side to side, that the posterior teeth aren't in contact in eccentric occlusion. And I'm just going to blend this with the Ultrabond, or with the football-shaped diamond. Now we're going to start taking the needle nose diamond. And what I'm doing is using that needle nose diamond, and I'm opening these embrasures and getting rid of the shoulder. And now I see Ultrabond that's still bonded to the gingival tissue. See that coming loose there? Okay. And all I'm doing with this 4 power is going around making sure I'm not touching sensitive tooth structure. There's a little Ultrabond left here on the central. And I just go around the edges like this. And I just barely touch the porcelain. I always like to take the lateral, and I do this all the time. They usually produce it so it's a little more square for you. And if you like to keep it square, you can. But I'll show you here in just a moment how it makes the lateral look narrower. See that? Okay, so now I've got a long diamond here. Okay, and I come back and I just open these embrasures a little bit, because finishing off those embrasures is what makes this look nice. Okay. And I've taken out some Ultrabond I see here on the Occlusal. Okay. We're going to take the Seri saw here, and it was developed by a dentist by the name of Dr. Harvey Putter. Now, I'm not using a lot of force. If I start running into force, then I just start rocking. See how I just rock that in? It's all in following these simple procedures, getting your bonding, taking your time, removing some of the excess, and then when it doesn't saw, you just rock. I'm using a little bit of force here. And this is what I usually do with the patients, is I open all the easy contacts. And what I don't do today, I can do tomorrow. And now I'm going to come back with the Seri sander. I'm using a lot of control here so I don't slip. I use a good strong finger rest. And I don't do all of them today. Okay? Okay, now let's do one last look at occlusion. Close tight. And let's take a look and see where we have some potential problems, if any. That lateral incisor is going to be a challenge, so I'm going to have to take a little off that lower and give it a little relief there. And what I do is I take it off the labial mostly. And we're going to take a little off this bicuspid. All right, so now we'll take a look at the patient overall. Look at how you can see that lower cuspid locking in that lateral, and we were able to correct that. Now look at her. Huh? Kind of nifty, huh? Now you get to take a quick look.
Wow,
Now you can
that's
use
beautiful.
these, and you can.
Thank
It's
you.
beautiful. You want to keep it?
Yes,
You
I
sure,
do.
huh? Yeah.
Mhm.
So that's
Yeah.
why I like this procedure, because if I put in a 0.5 millimeter margin on her enamel and they didn't like it, I've irreversibly changed the contour and appearance of those teeth. So now I just take that out. We'll have you back in a week.
Okay.
Open some more contacts. You won't be able to open floss in all of them, and you can just use them normally and brush, and you'll see little white things popping off here and there. Okay.
Thank you, doctor.
You're
Oh my
welcome.
gosh.
Well, my teeth weren't perfect. I had a gap and this crossbite, and I wanted to get Lumineers because I knew, I could have a perfect smile, and I knew doctor would do a good job. So I went in and got them, and I have nice teeth now. I'm so excited. It's like my dream come true. I'm really happy, and my family was just very, very amazed at the difference. Because now they look full, and I just have a nice, bigger smile. I would not have gone through the pain or have my teeth ruined. The good thing about Lumineers is that they're reversible. If I didn't want them, doctor would be able to, take them off, and I would still have my teeth under there. But I just love this smile, not my smile before. So I wouldn't ask him to take them off. I'm very confident now, more than I was, because I am a confident person. But with my new smile, I can, I think everything's perfect now. It was just that one thing that I always had throughout my whole life, that I wanted to change. And, now I have perfect teeth, and it's made a big difference in my life. Mm-hmm. Lumineers is the best out there, I think. And, without it, I don't know what I would have done, because braces, I would not go through that. I know it's not that painful, but it is, and it takes a long time. And with Lumineers, it's a 1 hour thing. I think that's just great. I would recommend it to everyone who needs their teeth fixed.